All right, good afternoon and welcome everyone. Thank you all so much for joining us for our Mental Health Colorado Candidate Forum. I'm Vincent Atchity. I'm the President and CEO of Mental Health Colorado. We are proud to serve as Coloradans' voice for healthier minds across the lifespan. We're the state's leading advocate in promoting mental wellness, ending shame and discrimination, and ensuring equitable access to quality mental health and substance use care. As a nonpartisan organization, Mental Health Colorado does not endorse candidates, but we are very interested in educating candidates from all parties, as well as all voters. We want all Colorado voters to be confident that anyone they're voting for will be leading us in the right direction when it comes to mental health. The mental health needs of Coloradans are dire. Our state consistently ranks in the bottom third of the nation in terms of the magnitude of our health needs and the difficulties we too often face in accessing quality care. More than half of the Coloradans who need care never get it. We have one of the highest suicide rates in the country. Through our misuse of alcohol and other drugs, we harm ourselves, our families, and each other. And we too often rely on law enforcement to respond to mental health crises. This leads to criminalization, injuries, and death. Jails and prisons are our largest mental health facilities. We need elected officials who are going to prioritize healthier minds across the lifespan, and that's why we're here today. Today, we are meeting some candidates for the State House of Representatives. We will also have one candidate with us for the Board of Education joining us today because of a scheduling conflict for the Board of Education Forum they were hosting next week. We received much interest in this forum and we weren't able to include every candidate. If your candidate is not here but you'd like to see your candidate's statement regarding mental health, you can visit mentalhealthcolorado.org. On our homepage is a section for candidate mental health platforms. I'd like to thank the candidates who are here with us today. Thank you so much. As a reminder, this is not a debate. Instead, it is a conversation and an opportunity to educate voters about mental health issues in the state and the important role that state representatives and other elected officials can play to support mental health. Before we introduce the candidates, I want to let all our viewers know that there will be time for questions at the end of the forum. If you have a question and you're watching on Facebook, you can leave a comment. And if you're joining the webinar by Zoom, you can use the Q&A function at the bottom of your screen. So I'm going to start by just sort of going around the screen and calling on candidates to introduce themselves and just say maybe a sentence about your interest in mental health. We're going to take more time to get into that, obviously, over the course of the hour, but it's really your name, your district, where in the state that is, in case everybody's not familiar with the numbers. And I'm just going to go around and pick people and begin on what I'm seeing on my right here is Stephanie Vigil.
Oh boy, I get to go first. All right. Well, thank you so much, everyone, for being here and for participating in this and hosting. I've been really looking forward to this one for a while. I am a candidate for Colorado 16th House District. Sorry, I'm having a computer issue. Can everybody still see and hear me? Okay, I apologize. All right, thank you. So this is very close to me. It's a lot of my personal story comes from my survival of trauma and disability from mental health issues in my younger adulthood. And so much of what drives my passion to go into public service and to do political organizing is to make those systems of support better for other people. The ones that failed me, they should not have to fail other people. And so I'm really excited to hear from all of you and collaborate on what is in our collective vision for the state of Colorado and to heal some of these wounds. So thank you very much. Again, it's Colorado House District 16. It's the central east part of Colorado Springs.
Thank you. Thanks for being with us, and thanks for remembering to tell us where your geographical area is. I'm going around my screen, so Andres Pico, please introduce yourself.
Good afternoon. I'm Andy Pico. I'm one of the candidates for House District 16 in the central northern part of Colorado Springs. I come to this with a pretty good concern about mental health across Colorado. I've walked a couple of people through the system over a couple of decades now, and that has been quite an eye-opening experience to find out the shortfalls and just how difficult that can be to access. I've been serving now on Colorado Springs City Council for a couple of terms, and this has been an issue that we've had to deal with. As noted in your introduction, the jail has turned into the de facto mental health facility, which is not what they're equipped for or trained for or anything else. And we've gone a great deal to try to provide some of those extra resources using the CARES team, which the fire department does a preemptive health and we've done the same thing with our police to dispatch a mental health team as opposed to just law enforcement anytime there's an issue. One of the issues that I've noticed is that the state closed some of the mental health facilities. We used to have a couple of hospital wings down in Pueblo. They're not there anymore, and that has dumped an awful lot of people out onto the streets. And as I've said, they kind of end up in our jail, which is not the right way to deal with it. So it is a very personal issue of mine as well, and it's something we need to address and address at the state level. Thank you.
Thanks for joining us today. And I'm just going to keep going around my screen. And the next person I'd like to introduce yourself is Mei-Ling Simpson, and you're actually our candidate for State Board of Education today. Isn't that right?
Yes, thank you, Vincent, for working me into this forum, as I couldn't attend the first one that you asked me to attend, which was on state candidates. Yes, I'm Mei-Ling Simpson. I'm running for State Board of Education from Congressional District 3, which is all of Western Colorado and much of Southern Colorado up to Pueblo. It's a huge district. It has 750,000 inhabitants and 54 school districts. My interest in mental health, of course, is that of preschool children and children who are in school, K through 12, making sure that we are reaching their needs, because without good mental health, they cannot really be good students. So we need to pay close attention to this. So this is one of my issues. Thank you.
Thanks for joining us. Next, I'm going to ask Judo to introduce yourself, please.
Hello, good afternoon, everyone. My name is Judo, and I'm the Democratic nominee for House District 41. For me, mental health is one of our top priorities and should be. Knowing that HD 41 encompasses a lot of Aurora, we have experienced a high need for mental health resources and discovering new ways to navigate what policing in Aurora looks like, coupled with quality mental health resources, rather than really going directly to ending up in the back of a police car. As a teacher, I also believe that we need to increase mental health resources from a very early age, just like Mei-Ling said. And I think we need to increase mental health resources through K through 12 especially. And so I would really like to partner with future collaborators to see how we can get this done.
Thank you. Thank you so much for joining us. Next, please introduce yourself, Representative Lontine.
Thank you, Vincent. It took me a while to get myself unmuted. Hi, I'm Susan Lontine. I'm the current representative serving House District 1 and running for my 4th and final term. And House District 1 is a part of Denver, and so I represent the southwest part of Denver. I do have one precinct in Jeffco, but it's pretty minor. The rest is all in the city and county of Denver. And as a legislator, I believe that, working on issues around mental health will also help us with access to physical health as well, and making sure that, you know, when people are struggling with their mental health issues, they're often using utilizing our healthcare system in really high cost ways. And so one of the things that we can do to make our system as a whole more affordable is to work on mental health. But it's not just about money. It's also about taking care of people in a way that's just and safe. And access to mental health really goes a long way there.
Thank you. Thanks for joining us. Next, please introduce yourself, Colin Wilhelm.
Thank you, Vincent. Yeah, Colin Wilhelm. I'm candidate for House District 57, which is essentially Northwest Colorado, Rio Blanco, Moffett, and Garfield County. It's if you go from Grand Junction and go north, all the way over to the Glenwood Springs Canyon and Steamboat, it's pretty much there. And so it's a rural, vast area up here. And for me, mental health is very important, and particularly, we have essentially some diverse areas of mental health practitioners in the towns, but not much in between, and not much that's utilized even in those towns. I myself have struggled in the past, and I'm a recovering alcoholic, and that's led me to becoming where I am today in leading the voice for mental health out here. I am working on plans to increase access out here digitally with broadband, and also to get some more facilities out here, be it inpatient and outpatient. We have basically lack of inpatient is throughout the state, but even though we'd never want to utilize it if it's not necessary, sometimes it is, and we have almost no beds out here for mental patient inpatient care when it's definitely needed. And so from that aspect, I want to work on that. And also I have a plan to expand the public-private partnerships for putting healthcare professionals into schools at no cost to the teachers and no responsibility to the schools from the state by upping that budget and expanding the program that's there. So that's what I'm looking forward to handling with mental health care. It's probably my number 1 or 2 priority out there.
Great. Thank you so much for joining us. Kevin Sipple, please introduce yourself.
Hi, my name is Kevin Sipple. I'm a candidate for House District 13. House District 13 is Clear Creek, Gilpin, Grand, and Jackson counties, way up near the Wyoming border, and half of Boulder County, from, if you're familiar with Boulder, from about Broadway west to the Continental Divide. It's a really diverse and kind of large district. The diversity comes in between what the last gentleman was describing about rural Colorado out west, whereas Jackson County only has 1,800 voters in the whole county of all kinds, and only one major town, Walden. Walden is, there's a shortage of all kinds of health type facilities in places like that. Walden doesn't even have a drugstore. They have one part-time clinic that can't keep certain drugs because they don't have a drugstore in town. That would be one of the things I'd be working on. My interest in mental health came not basically from my business, which I have a background in business, but my mental health interest pretty much came from my volunteer work. Starting in 1992, I was a board member for the Placement Alternatives Commission, which is an appointed social services board that managed 7 programs designed to keep families together. In 2001, I became a sheriff's office victim advocate, and I'm still doing that. I just can't bring myself to leave it. It's the people in the program are so good. In my experience, police officers are very good people, and virtually all of them got in the business to help people and not to be mean and throw people in police cars and hurt them. We're lucky in Colorado to have some pretty good police forces. Boulder Sheriff's Office is excellent. They have a couple of programs that they actually actively practice. One, they call it verbal judo. They teach the police how to deal with difficult and non-difficult people alike, just by saying certain things that are designed to keep them sedate or settle them down or whatever. And there's another program called, which you may all be familiar with because it's pretty widespread, at least in the Denver metro area, mental health first aid. And that's a teach that all kinds of people get: social workers, police officers, victim advocates. And that's basically to recognize when people are in crisis and to help them out. I have an interest in suicide prevention. It's based on some experience I had as a victim advocate, but I'm a member of the Suicide Prevention Coalition of Colorado and have been to a bunch of their trainings. And suicide is a serious problem. Colorado is 7th in the nation for it. I think I may have just heard someone say 3rd in the nation, and that may be true this year. This year, because of the COVID crisis, there is a lot of suicidal issues going on. It's almost an epidemic among youth. There's the nationwide, the National Suicide Hotline has increased during the COVID crisis by 338% in call volume. And it's actually a big problem and needs to be dealt with. Police officers themselves actually have a high suicide rate. That's probably enough for now.
Yeah, I'm just going to interrupt you because we're just doing introductions, and then we're going to get into some more opportunities to share thoughts about things. And then finally, Tracy Burnett has also joined us. Would you please introduce yourself?
Yeah, hi, I'm Tracy Burnett. I'm a Democratic candidate for House District 12, which is Eastern Boulder County. It includes Lafayette, Louisville, and part of Longmont. And, you know, to me, mental health is an integral part of healthcare. My kids have used it like Safe to Tell to help prevent suicides of some of their friends. So this is really important to me. I'm not going to repeat any of the things that anybody else has said. I'm just going to add to what people have already said. I've done years of community service with human service organizations, and one real part I've learned is that that affordable housing is a critical component of good mental health, and this is a real issue, especially in Boulder County. If you have a safe, stable housing, affordable housing, that is the base for building a more supportive mental health environment. So I just wanted to add that. And also, Kevin, I want to add to you too that, yeah, youth suicide prevention is a huge thing, especially among the LGBTQ people. So this is really important to me. Thank you.
Thank you so much for joining us. So at Mental Health Colorado, our mission is to achieve healthier minds across the lifespan for all Coloradans. And to us, this means providing a strong start for all of Colorado's children, support for families, access to supports and services, ensuring that we experience wellness in aging, decriminalizing mental health and substance use conditions, and ending shame and discrimination. I've got a bunch of different questions for you. We're not going to have time for them all because we'll also take questions from folks who are here to listen today. I will try and get through 3 of my questions and give everybody who has something to say about them an opportunity to talk. Please just limit your remarks out of respect to the other folks on the call so that everybody has time. We're going to try and give everybody equal time without using timers or anything like that. So I think that I want to begin with just the issue of mental health itself. And, you know, historically, all kinds of shame and discrimination have been associated with mental health and limited our ability to acknowledge our needs and recognize them as health needs. And yet, at the same time, we know that mental health, like physical health, is something that we all have and that we don't have in a constant way over the course of our lifespan. We experience variations in the quality of our mental and physical health from one end of life to another, and we're all vulnerable to crises and to long-term chronic conditions. And yet we have this shame and discrimination. And so just to get us going, what thoughts do you have? What sort of tips and tactics might you suggest about ending the shame around mental health, and suggestions about how to overcome the barriers that prevent us from talking about mental health and acknowledging our needs? So there's question number one. And if you want to make a remark, please just sort of give me an indication and I'll just pick people as I see them. Stephanie Vihil, please share your thoughts with us.
Yeah, it's just Vihil is fine. No, I love this question. It's been such a huge part of my own healing, to be honest. Is that for a long time we've been operating on a disease model of mental health with very little variation beyond that. And that's not to say, of course, that they're not real illnesses that we need diagnostics and medical intervention for, but just that it's a very limited model for us to look at our mental health and well-being to just think in terms of like, I have a disorder or I don't have a disorder, right? So you're one of the sick people, or cringy enough, one of the normal people. And of course, as you say, that doesn't describe the whole breadth of our experience. And the reality is that all of us have some part of us that is not always healthy and other parts that are. And so that part's perspective, being able to break down the mental components of what make up who you are and think beyond either I am a diseased person or I am a normal, healthy, mentally normal person, really helps open up the conversation so that it doesn't have to be, I am a depressed person, or I am a bipolar person, or I am a schizophrenic person, but right now, this is what I'm dealing with. And tomorrow it might be what you're dealing with. And in a year, I might not have this problem anymore at all. And so if we can break outside of that disease model and think in a bigger framework of total wellness, just what does it look like to be mentally healthy and well and thriving? And then we can deal with symptoms as they arise.
Thank you. Iman, sorry. Tell me again.
Got it, Iman, yeah.
Very good.
So this question is something that I struggle with quite a bit. Knowing that Aurora has a high concentration of not only Black and brown individuals, but a high concentration of immigrants and refugees, this is something that my community struggles with quite a bit. I'm the spokeswoman for the largest and oldest mosque in the Rocky Mountain region, of which has 5,000 congregants, and many of whom are in fact immigrants and refugees. And so being the daughter of immigrants and refugees, a first-generation American and Coloradan, but a lifelong resident of this district, I've been able to witness kind of this diverse tapestry of how mental health is received. And unfortunately, there is quite a bit of taboo around the definition of mental health and really accepting those resources in your time of need. And just like Stephanie says, the myriad of resources and needs that the people of Colorado have when it comes to really what mental health includes is so vast that we need to start destigmatizing that essential stigma around mental health and reaching out for help. And that could be something as simple as I need to see a therapist every so often, to something a little more, or maybe much more serious. Again, as a teacher, I have lost a student to suicide, and he was a young man who had that facade of everything is perfect. He was happy, he was the glue, he was the person that everyone flocked to. And that really, inspired me to work with Representative Daphne Michaelson-Janae to pass legislation to make sure that, our youth have suicide prevention and counseling without parental consent, so that they can have the resources needed to, again, start taking away at stigma and keep our children safe.
Thank you. I saw Tracy's hand, and then I saw Colin's hands.
Yeah, I think it starts with telling personal stories. I had a time in my life where my favorite grandmother died. My dad had a life-altering medical incident, and I had a miscarriage all within a 3-month period of time. I was depressed. It's pretty hard to pull up your bootstraps when there's no bootstraps to pull yourself up by. So I went to therapy, talk therapy. It took me a year. And I think telling these kind of stories that just like a physical, health issue, sometimes you can recover, and other times it's a chronic condition. But just telling those stories and breaking it down, if it isn't your story, telling other people's stories, especially for people of color, where every single day they are, put down and discriminated against. So I think it starts with telling those stories. Thank you.
Thank you. Colin.
Yeah, thank you. It's a great question, and it's really something that we really need to work on in this country. And for me, telling the stories and working with the individuals, it really starts there, removing the stigma and the guilt and the shame that the individual seeking help at the beginning feels. Not necessarily they're not necessarily in their right mind of the way they're thinking yet, and how they feel that guilt and that shame. So first, we need to help them recognize that they're not shameful or guilty, whether they're in mental health treatment for schizophrenia or anything like that, or if it's through addiction. We know that over 80% of all people that suffer from addiction suffer from mental health, and a large part is self-medicating there. And in that sense, we need to make sure that they recognize that while they might have done some things that they are ashamed of, they are not shameful people or are guilty people. And they carry that burden with them. And we need to help remove that burden, and we need to do it properly and welcomingly. But also, in order to get society to continue to move towards this path, we need to recognize times when we need to call out when people are using that shame and that guilt to either oppress or put other people down. Not going to go into it, but Tuesday was a dark day for the president doing that at the debate. But it was very welcoming to see no matter your politics, the vice president being proud of his son for getting through his mental health issues, and putting those stories forward and making that point of being proud of his son was huge for my community and for the people that I work with on a daily basis. And we need to encourage more people to do that. And then when people recognize that they've been acting wrong towards people of addicts or mental health, people that have mental health issues, we need to welcome them with open arms in their desire to change their views there and not push them back against those views. And that'll welcome them into the society and help lead to a greater change and understanding, removing that stigma, that shame, and that guilt.
Thank you. Andy, I think I saw your hand. Yeah.
One of the issues on trying to remove the stigma is make sure that people who need help can ask for it without having the impact come back on them. I've been involved in security, both national security as well as our local, and that is an issue. When you stand up and say, I've got a problem, that can affect your security clearance, can affect your job. And so people are very reluctant to do that. When we have to remove that, and we have to ensure that they can get the assistance that they need, because all too often, particularly in the military, I've seen too many times when I've stood next to a coffin and none of us knew that they had a problem, and it's too late at that point. So that's something we have to work on.
Thank you. Thank you all. Would anybody else care to share any remarks about overcoming the barriers? Very good. Representative Lontine, please.
Thank you, Vincent. I had my cursor right over the mute button, so I was a little quicker on the uptake. Thank you. Like a lot of things, I think that shame and stigma are things that are taught to kids and learn as we grow older, that we're afraid to reveal those things about ourselves because we've been taught that that's a shameful thing. I think one of the best things that we could do to help remove that is to teach our kids from a very young age that, you know, what emotional healthiness is like and how it's okay to ask for help when they need it. Two of the things that I've done since I've been at the Capitol is I worked on a bill in early childhood that limited the discipline for young children so that they wouldn't be inappropriately suspended for, you know, oftentimes behavior that's pretty normal for little kids. And this was something that we saw happening a lot to our children of color, especially our Black boys. And, you know, it's hard to want to be in a learning environment that you don't feel welcome in. And it's hard to feel welcome when, you know, you're removed from a classroom for acting like a little boy. And so that is one of the bills that I was able to get done, and we had a couple tries and finally got that done in 2019. I was really proud of that. Another bill I worked on was the comprehensive sex ed bill, and parts of that were about teaching children about what is a healthy relationship, but not just, you know, in the context of, you know, the straight relationships, but also that, you know, healthy relationships are also can be found in LGBT relationships, and that, you know, the younger we teach kids that we should be accepting of others no matter who they love, the better able that the kids who are have a different sexuality than the norm can learn to accept that in themselves. Often we see a lot of kids who, because they are struggling with that, have a lot of mental health issues. So, and a lot of that stems from their non-acceptance from peers. So whatever we can do to support all kids and let them recognize that those are healthy relationships as well, I think will help remove some of that stigma.
Thank you. Kevin, please.
I wanted to mention a lot of people have talked about the stigma of mental health, and it actually is a big deal. Like the gentleman next to me was saying, in certain kind of organizations like military and police, there's the impression that we have to be strong, especially for men, but women too in those organizations. We have to be strong. We're not allowed to be weak, and mental health means you're weak. That's left over from the old days when it was actually shameful and something to hide if you thought you might have a mental illness, or if it was in your family, you hid it. It was it is getting better. The whole situation is getting better slowly, with more people talking about it, and programs in the military and in the police agencies where they actually have to get mental health checkups from time to time and talk to people. A lot of people would never do it if they didn't have to like that, but we still have to continue because it's still there. Even I would have embarrassment about saying I had mental health issues, and I'm not even in the military or police. It's just kind of one of those things that our culture has sort of made it seem like a weakness, where in fact everyone does it. Everyone has it.
Thank you. Yeah, and it's not just our culture, it's an international phenomenon. I was at a global conference on mental health, and a representative from India mentioned that this may be one of the things that we all have in common internationally, is this experience of shame and stigma around our mental health vulnerabilities. And Mei Ling, please.
This has been a really interesting discussion, and I really appreciate what everyone had to say, and it's raised in my mind a question, which is, how much do our school systems address this? with kids at school. So you have raised my antenna to look at that issue. I think the earlier we introduce children to the concepts of mental health, good mental health and poor mental health, the earlier we introduce these concepts, the better, because as someone did mention, we have one of the highest child suicide rates in the country, especially kids between 10 and 19. And this is very worrisome, and it is culturally produced. I don't think this is a natural phenomenon. I think that something about our culture, and it's something about Colorado culture, is causing this problem. So thank you. And I will, if I'm elected to State Board of Education, I will certainly keep this issue in the back of my mind for the curriculum.
Thank you. All right, I'm going to move along to my next question. I think we've all had an opportunity to say something on that one, and I'm going to fold two of these questions together because we may only get through another one or two of these before we take some questions from participants in the call. You know, we at Mental Health Colorado talk about healthier minds across the lifespan. Maybe you could share some thoughts about what improving mental health across the lifespan looks like to you. And as part of that remark, maybe share some thoughts about what specific barriers to accessing healthier minds across the lifespan or quality mental health care are prevalent in your district and in the community you're serving. I'll give you a second to digest that. There you go. Colin, please.
Well, yeah, that's a great question. And I believe that we need to, part of removing the stigma is teaching kids that proper mental health is receiving mental health care when necessary. And one way to do that is something that I've been working on in the Roaring Fork Valley out here and in Routt County up by Steamboat, Mountain Family Health and Northwest Colorado Health Alliance up in Routt County have programs where they put the mental health counselor into the schools a couple days a week, middle schools and elementary schools for now. And the kids can go there if they need to, or if a teacher directs somebody to go to the mental health care facility person, they're there. It's no cost to the teacher. It's a public-private partnership, so the state helps fund it. The school doesn't oversee it other than having the facilities available and, you know, some security as we do in all schools and that sort of thing. And currently there's a budget for $5 million at the state, which is literally a drop in the bucket and nothing to do that statewide. We need to increase that budget and expand that program to a lot of other schools. I know other school districts have those programs. I don't have any interaction with those school districts. That's why I can mention the two that I've been working with and learning about up here. And so that's what I think is a great way for us to at least get started at the state level and in the state house. And that's what I want to do.
Great, thank you. Iman.
So when you ask this question, one of the first things that comes to mind is actually some of our older community members. And, you know, my father fought cancer for 6 years. And, you know, just like someone mentioned earlier, my brother's also a lieutenant colonel in the Air Force at the academy. And so I hear this kind of myriad of mental health needs. And again, I think the culture that comes with it. But specifically to this question, when I watched my dad, along with our entire family, go through this process of really, you know, accepting the end of his life and, you know, what that meant for, you know, our future as a family, the toll that really took on us emotionally and mentally was incredibly high. And so that personally prompted me to start my own therapy. And it's it was a godsend. And again, I think fighting that stigma, even culturally, was something that I had to do myself. But the reason I bring up my dad is because, you know, dad saw his 75th birthday, but while they had resources available for him during treatment, I don't think it was as prevalent and as, to be honest, in your face as it should have been. I think that, you know, when you do have, you know, Tracy mentioned this, right? Going through those life-changing moments, whether it is an illness or a reproductive right issue or something along those lines, right? Anything really, we need to know and have those resources almost readily available to us. And for my dad, you know, at 75, who's really concentrating on getting better or his health or staying safe, talking to someone about what he was going through was not really brought up much, and it wasn't something he was even thinking about. And in hindsight, I wish it was something that we did do for him to kind of ease him along this journey, and really make sure that we provided all of those resources for everyone in the family that was experiencing it.
Yeah, thank you. And, you know, I think that along with that history of shame and discrimination, it's not just that we need access to clinical supports, it's that we could be better schooled ourselves to know how to be supportive of each other's mental health needs. It's sort of an undeveloped potential that we have as individuals. So, Tracy, I saw your hand as well.
Yeah, Iman, thank you so much. I'm so sorry to hear about your father. I lost my mother several years ago after a very long illness. And I was basically a sandwich generation, taking care of my family and taking care of a, you know, very ill mother. And to me, one of the things that we need is more telemedicine. And this is, I think this is coming out of this pandemic. This is one thing that we can work to break down those barriers, because it's hard as a sandwich generation person to find the time to even set up the appointment and go to the appointment, especially, and both my mother and I both needed it. So telemedicine, I look as one way that we can really bring things, you know, help people more. Thank you.
Thank you. Kevin, I think I saw your hand next.
Yes, just kind of wanted to mention one thing that I think would help, and that would be, as a state representative, if I would be elected, I would kind of focus on trying to make budget issues kind of follow more along the lines of common sense. We're not exactly doing that right now, and in the area of mental health, just this past June, several decisions were made when the legislator went into the emergency session to help figure out the budget and to do some of the bills that they hadn't gotten done before the COVID crisis started. There was a lot of decisions made on what needed, how are we going to replace our $3.3 billion shortfall in our budget this year. And they decided to cut a lot of things. Mental health was one of them, but some things they didn't cut. They didn't cut the Fast Tracks program, where we're spending, in the end, by the time they expect, it's going to cost $4.7 billion. It's probably going to cost way more than that. We've been being taxed for it since 2004, 4% on the sales tax, and they don't expect it to work until 2050. And trains are not a good idea. That's just one train from Denver to Boulder to Longmont. That's not a good way to spend money, in my opinion. I think it does need to be spent more on some of these important issues, mental health issues, especially in this time where everyone's isolated at home and where there are more mental health problems now than there maybe ever have been, or at least they're more in the open.
Thank you. Stephanie.
Yeah, I don't think that it's possible for us to continue tackling mental health issues solely as individuals the way that we too often have been doing this. Only because human beings are not solely individuals just as a species. That is not how we have evolved. It's not how we live. It's not how we thrive. We live in families and communities and broader societies. And so when there is trauma, trauma is also collective and it's cumulative over time. And one of the things that's hit my generation so hard, and I'm an elder millennial, I'm in my mid-30s, is just the effect that cutthroat crony capitalism has had on our generation. We're all in a ton of debt. None of us are getting paid enough to live on. The prospect that we're going to own a house and have a family just looks dimmer and dimmer. And over time, you kind of start to look at that and think, well, how much of this is just everybody becoming mentally unwell because we feel like machines? And because every day we're expected to get up and be good for the economy instead of being able to be a living, breathing, full human being and expect the economy to be good for us. I started reading a study last night that I thought was really interesting in the context of this, and I wish I had not been too tired to finish it. But it's called The Tragedy of Growth, and they're breaking down how much our fixation on GDP and stock market growth and just more and more and more and more and more all the time is selling us short as whole communities and as human beings. It doesn't make us happier. It's not making us healthier. It tends to lead to, boom and bust economic cycles that ultimately cost us more. And in the context of something like what's going on with COVID, we're almost sort of addicted to that growth where we're having these conversations about like, well, how many hundreds of thousands of people are enough to die because we can't afford to stop growing the economy because it's just been designed that way. It's been designed to have to be constantly growing. And we can do that differently. And we can do it in a way that protects our livelihood from, like you said, throughout the lifespan. It's for children, it's for aging folks, it's for everyone in between. And at the end of the day, if people aren't happier and healthier and better off because of all the growth that we're doing, then it's just empty growth. And so I don't think that there is a way forward for us here as a state in Colorado or as a country for us to really address whole epidemics of mental health issues, whether we're talking about substance abuse and opioids and depression and suicide, without addressing it in that broader context that is such a clear trigger for so many of us.
Thank you. Mei-Ling, please share your thoughts.
I completely agree with Stephanie, and I want to thank her for that beautiful exposition. There are a lot of people out there saying we're putting profits before people, we're putting wealth before wellness, and it's making us all sick. So thank you, Stephanie. That was really great.
Andy, I think I saw your hand.
Well, I'm going to disagree with those last two comments. Colorado is under a lot of stress right now, as is the country, as is the world with COVID. We've really been hammered hard, and everyone is under a lot of stress. I like what Kevin talked about, second most of his comments. I'd also point out that Tracy talking about telemedicine, I think leveraging technology to help us get through. We've been doing that with these kind of conferences. A large measure of being able to deal with the situation you have is having a good solid economic base. And the fact is that when you have a growing population, you need to have a growing economy that puts those people to work and gives them meaningful employment and an ability to deal with issues that come up. So I'll disagree with the last two people. I think that's absolutely the wrong approach. I think we need to have a good solid economy. We also need to address the issues that we have in mental health. One of the initiatives that is going on right now, which I think is a very good one, is taking a look at the state level at all the various programs and taking a look at how to merge them and make them work together a little bit better and perhaps leverage an awful lot of those programs and get them to work and make those funds go that much further. It does take a lot of state funding to get the mental health system up and running, but it takes a good, strong economy to make that work. You don't get state funding if your economy is in the tank. So that's where I'll disagree. Thanks.
Thank you for sharing your thoughts. Colin, I saw your hand.
Yeah, I would just like to chime in on that last statement and respectfully disagree that the economy is the driving force right now. Really, we need to, yes, we need to balance opening our economy. As another elder millennial in my mid-30s myself, who has extreme law school student loan debt, but also runs his own business and is a functioning member of the economy, while also having a mortgage and a family, a wife that has a full law school mortgage debt. I can tell you the stress of that is not alone in me. It is felt by all millennials, and we are also the largest voting bloc in the state. And to say that the economy breeds better workers when you don't have, if you don't have the people that have the mental capacity to go to work every day and be that functioning member of society because they're so stressed out from being in debt or because they're so stressed out from other things and don't have an outlet for mental health treatment, you're not going to have a functioning society. You're not going to have people going to work, and you're going to have a failing economy in 20 years. That might be fine for you, but in my mid-30s, that's definitely not going to work out for me. So I have to respectfully disagree that I would put mental health over the economy, especially in the time of COVID right now. Thank you.
Thank you. So we're going to run out of time momentarily, and I want to make sure we take a question from some of the folks who are listening in on us. So I will ask this one and give as many folks as we still have time to give a response to it. This is a question from William Richards, who asks, if you support decriminalization for individuals who've been arrested during a mental health crisis, and if you feel it would be appropriate to wipe their record clean. Would anybody care to share a thought about that? Sorry, I had my mute off. Andy, please go ahead.
Yeah, absolutely. That's essential. Of a couple of people that I've walked through there, one of them did have law enforcement involvement, and that was an issue. And I think someone is having a mental health crisis. That's not criminal. That's a mental health issue, and it absolutely should wipe the record clean.
Thank you. Stephanie, I think I saw your hand.
Yeah, no, I absolutely agree with that. And in addition, like we've talked about before, getting care instead of cuffs. That the important thing too is that we don't have armed police officers showing up to things that are best suited for therapists and social workers and community leaders who can shepherd people through those kinds of needs. We have to remember too, I was talking earlier about the cumulative toll of layers of trauma over someone's lifetime. Especially for people of color, especially for Black folks in Colorado. The more interaction you have with the police, the more trauma you have built up. It's just a fact of life for Black communities. And so to even have that added to your troubles in the first place is a travesty that we can absolutely avoid. Here in Colorado Springs, we have a community service patrol that handles, they're unarmed officers. They're not quite police officers. They don't, they don't carry a gun. They can't arrest you. They handle more peaceful situations. It would be totally reasonable to equip those folks to handle mental health triage and mental health first aid, and to be able to assist in that way, so that we don't have anyone with a criminal record that they have to negotiate in the first place. The more paperwork you have to go through and phone calls you have to make and appointments that you have to make when you're already in a bad place, the more likely you're going to end up being one of those slip between the cracks kind of people. So thanks for that question too. That was a good one.
Thank you. I think I saw somebody now. Kevin, please share your thoughts about that. Yeah.
Are you me?
I think I saw you raise your hand. Yes.
Yes, I did. I thought you were calling on someone else.
Multiple times.
Oh, sorry, I missed it.
I'll just be fast. Yes, I believe that that the record should be expunged on things that are mainly mental health issues. one way to ensure worse and worse police involvement over years and possibly leading to a life of crime is too much police involvement. Once you're like labeled as a troublemaker or a criminal, it's just going to get worse for you as time goes on. And if it was some sort of a temporary mental issue that got you in trouble, that should be undone. And hopefully it can be taken care of before someone commits major violence or kills someone or something along those lines.
Thank you. Representative Longteen, sorry.
Thank you, Vincent. I would support decriminalization of folks who were in our criminal justice system because of a mental health crisis. We did pass a bill this past fall that did that for folks with, marijuana offenses on their records. And the least we could do is to help folks with mental health crises who really shouldn't be in our criminal justice system at all. But through lack of resources, that's usually where they end up. Denver does have a pilot program going on where they have social workers joining police officers on certain types of calls. Not only is it helpful to de-escalate situations, but also, helps folks get into the care that they need and keeps them out of the criminal justice system to begin with, so that they don't have those inappropriate criminal records. And also, just from a safety perspective, even in my district, I've had Denver police has had several situations within the last year of folks who were having a mental health crisis, and police were called, and the person in crisis ended up dead. And because it got to an escalation. And so certainly whatever we can do to avoid that, and to also, protect their future, because if they have a criminal record, it's really hard to get a job and have a future. And just because you're mentally ill doesn't mean you're not capable. So definitely would support that. I do have to hop off. I have another call in a few moments. And so I just wanted to thank you for the opportunity to speak today, and wish everybody out there all the best. Thank you.
Thank you for joining us. And thank you for your thoughts. One of our initiatives is we're talking about care not cuffs, and raising that general level of awareness across the population that when you call 911, because that's what we've been trained to do to address a moment of distress, law enforcement will often be the response to that, and that people need to be very mindful about calling for health help and expecting health help for a health crisis, and not embroilment with the criminal justice system. So thank you, Stephanie, for mentioning care not cuffs. Thank you all so much for joining us today, and for providing a very rich, thoughtful, compassionate conversation. You gave the Coloradans and the nation a very refreshing reminder that civil discourse is possible, and that we can come together and talk about meaningful things for the health of our community, and work together to good ends. We are hosting our tribute gala event next week. It's a virtual event. We've got a silent auction, so we encourage people to register for free to participate in that by visiting our website at mentalhealthcolorado.org. And again, to see your candidates' statements are all available there on our website. If you've been inspired by some of the things you've heard today and want to become an advocate for mental health, please consider joining our Brainwave. It's our grassroots network of advocates who have lived experience and stories to tell about their mental health experiences in Colorado. We mobilize these folks to help us with our advocacy work at the Capitol and locally. One more remark is that too few understand what a serious commitment of public service it is to seek office as a member of the House. Nobody who seeks these offices is getting rich. It's truly about public service and is an enormous commitment of time and energy. And we as advocates are so grateful to you for the hard work that you put in and the attention that you bring to the health and well-being of your community. So I wish you all really well and hope that we'll get a chance to work together in the coming years. And that is going to wrap us up. We're right on time. Thank you for joining us.